Easy. All right, another Q&A, but we got a loaded roster this time. Dr. Dylan Seeley joining Dr. Serrano, and then Ben Velasquez as well with a sidekick with his son Milo. So we got a crew today. But right into it, thoughts on the carnivore diet?
Okay, actually, I use the carnivore diet. I've been using it for years before it came out, but I was using it for psychiatric patients. So I want to show the weaknesses first, because most people don't understand what the carnivore diet is, or they think I'm going to eat meat and that's it. You can't do that. The true carnivore diet included organ meats. American people don't eat organ meats in the United States. They leave the liver, the lungs, they put it outside and they don't eat it. In Puerto Rico, for example, we eat the tongue, we eat the liver, we eat the lungs, we eat the kidney, we make morcilla, which is an intestinal food, which is very important. So if you're going to use the carnivore diet and you don't have organ meats, you cannot do it. Unless, and I want to put a caveat there, unless you use liver capsules, which kind of give you the organ food of it, okay? Now, one organ that I would not eat is the spinal cord of the brain, because I do have people from different countries that will, hey, can we eat this? For example, from the sheep, they prepare a special, I forget the name of it. And I don't like that because there's a disease related to that, and I don't know what the source is. If you're going to eat liver, if you're going to eat a carnivore diet, the sources must be organic, because you're using organ meat. For example, if you're going to use the organ, the liver in this case, from a cow that has been fed junk, it's going to be in the liver. The older the cow, the worse the liver is, because there's more fibrous tissue in it. The younger the liver, the more messenger RNA, the more RNA you have, the more things good to you are very important. I also say that you must actually have a multivitamin. The reason I say that is because some people will tend to eat the same foods over and over and repeat, which will cause a deficiency in other nutrients. So I would recommend Core Essentials by Poliquin, Active Nutrients by Zymogen, and there's 2 or 3 other companies. I'm sure Ben knows other ones, or Dylan knows other ones, but that's my take on it. I have seen this diet do wonders, specifically in females, for inflammatory bowel disease, depression, bipolar disorder, and schizophrenia. If you're going to do it for any disease, most include a physician that is knowledgeable on the diet, because you don't want to, I'm going to do a carnivore diet because I'm depressed. Bingo, I'm going to do it. I usually will check deficiencies before I decide to do it. I can tell you with how many patients I've used it. I've used it in 22 different patients. 3 of those were inflammatory bowel disease, including Crohn's, ulcerative colitis, which all of them responded. The rest were for psychiatric issues. Every single patient did respond, but one. And that single patient was unable to do it. Didn't like organ meats or other carbohydrates here and there, which you can't. Now, a carnivore diet can include vegetables and can include other things once a time frame here, and I'm going to give you a time frame that I use 4 to 6 weeks if you're using it as a treatment for a condition. If you're not using it as a treatment for a condition, 2 weeks, you can start doing it, and then you can add a starch or have a cheating meal or whatever.
Yeah, some people add fruit and honey.
Yes, and the reason honey is wild, right? And again, that's another one. It has to be raw honey.
Yep.
It's actually give you other things. And fruits, I would not add even if you're using it for no medical purpose, I wouldn't use it until 3 weeks later. I will add vegetables first, and then I will add fruits later. Now, if you're going to do the carnivore diet on and off, be aware that cheeses or dairy products must be careful because the amount of toxicity and the amount of processing that they do with those. And a lot of people base the carnivore diet also on cheese and things like that because they think, oh, it's a high protein diet, which is not. Okay, I just want you guys to be aware. I don't know what Dylan wants to add to that.
I think you pretty much touched on everything from that aspect. Big on brain health, especially recovery from injury. I think that's especially since I work with fighters, I would say that's where it's most beneficial, like post-fight. I found that we've had really good success coming back from, obviously taking a bunch of shots to the head by just cleaning up the diet, eliminating a lot of the carbs, and just eating meats, especially organs. I mean, shit, we had organ meat today. We had morcilla for breakfast. So.
Yeah.
Oh, that's true. I forgot about that. And that, by the way, is intestinal food, by the way, in case you guys don't know that. I had a patient from Turkey and a patient from the Middle East that they included eyeballs in their diet, which is very, I mean, people laugh. Brian's laughing, but they eat the eyeballs of the fish, which Puerto Ricans do eat it too, of course, but I'm just saying that's cool.
Yeah, and that's Ben, you got anything?
The only thing that I would add is that, and Dylan hit on it, but in terms of rehab from concussion, we've gotten some really good results. I think the primary thing is changing the diet right away, immediately after the event. And we found, like Dylan did, the carnivore diet worked really well for getting kind of that immediate drop in inflammation.
I want to add one more thing. If you are a runner, and in this case, I'm going to say a long distance runner, you can use it. But what's happening initially, your stamina is going to drop drastically, because I did it with 2 triathletes. In that case, there are 2 triathletes there. And initially, when they told me my stamina was very, very low, 11 days. It took 11 days. But at the end of the 11th day, it was like a skyrocket. It was something incredible that was showing me that there was a system that was changing for fuel usage. I guess they were eating so many carbohydrates that when they changed it, they kept complaining, oh my God, I cannot run, I'm sore. And it took 11 days. After the 11 days, it was like they were it's incredible.
Yeah.
Sorry, Brian, for Dr. Serrano, to follow up on that, did you have any recommendation with regards to gender in that adaptability phase? You said 2 weeks.
Actually, that is a very great question. Yes, I do. And again, women are a very delicate, difficult species, okay? And you have to be very careful. So actually, yes, in women it takes 2 weeks. Okay. So it's crazy. But this is very interesting. In a male, 11 weeks you can see a spike on the energy. At 14 weeks, the woman is like putting diesel. They said, it's just incredible the amount of stamina. It's higher than the males. I can perform better. I can do better things. I can sit down and do my work, which is incredible.
Yeah, and then in particular, we already touched on it a little bit, but this is questions actually coming from a Navy SEAL where as application to TBI and just brain health in general. So now I would address like the longevity. Can you stay on this diet and not just keep it as like a post-traumatic event?
I have because I'm a physician, I don't like the best diet is the one that you're not. Like the best workout is the one that you're not. In life, we have seasons, and the reason God gave seasons is because the food sources are going to change. We can do a carnivore diet now because we have the supermarket out there. Then the season changed, the animals rotate, they move south, the snow, whatever it was happening, and they have to eat different grass, different soil sources, so they were able to do that. Now when we buy animals, it's just in one place and they eat the same foods over and over. So I'll say it's a permanent diet. If you are treating in a condition, again, as a physician, you can use this. I will go actually 6 to 12 weeks, and then I will do a shift for 3 days and then restart the diet. Now, that shift will depend on how the patient feels. I have a patient and that's the patient I was talking about, Turkey, that completely went off one day and he felt awful.
Yeah.
So I said, okay, we know that one day is not good for you. Let's do 6 hours, which he says 6 hours is fine. I don't get sick. I don't get anything. I'm going to continue doing it. And actually, we were able to rotate the 6 hour time every 7 days. And he was fine doing that.
Nice.
You pretty much nailed everything on that.
Yeah, in that realm. So like some people are using the carnivore diet to like cut weight and add muscle per se. And then one of the people that have asked me about the carnivore diet in relation has been like Taylor Lewan, like big offensive lineman who right now is recovering from an injury, like a knee injury, and then also like trying to lean down. Like obviously it's a pretty functional diet for that.
In that case, because he had a joint injury, I will add actually fats. Specifically, I would try to consume extra fats, either fish oils. I will add extra butter. I would add olive oil. I would completely stay away of polyunsaturated fats. Corn oil, canola, soybean oil, any of those I would not include in that diet.
I got you. Boom. So this kind of bleeds into the the plant defense chemicals and vegetables theory. Like, why is that misconstrued in this realm where you start to, I guess, you add vegetables to this carnivore diet or instead of fruit?
Let me establish there is no culture that has survived being a vegetarian culture. They always die, right? Number one. Number two is it depends where you are, location. That's one of my pet peeves when I'm giving a diet. Location is very important because I see people from everywhere. Now, if you live in a tropical island, I say fruits will be your first choice because it's easier for you to have access to the fruits.
Yeah.
Vegetables are harder to get a hand of. If you're in the United States and you have an area that you have access to vegetables, you're fine. Now, be aware that, again, those vegetables or fruits are spray. And there's the dirty dozen list that you need to stay away from it. If you buy supposedly organic, then you're safe. I would say this, if you're a female, I will add vegetables. If you're a male, I will allow you to add fruits first.
I got you, yeah. Because like they're technically calling it net negative for humans,
Yes.
just with these things. But then like they're asking about the conflicting studies where obviously you see the benefits of the phytochemicals in that realm. And then so this bleeds into the next question where it's the greens products that are out now, are those a quality substitute?
No, nothing is even, I sell I sell supplements. Nothing substitute for real food. I don't care who you are. I don't care what you tell me. Supplement what you're eating. That's what supplements are for. If you're not eating correctly, you can have 50 pounds of supplements and you ain't going nowhere. It doesn't matter. I laugh when people say, "Oh, I'm taking vitamin C and I'm taking vitamin D," but then I'm a nurse. But then I go eat my French fries. It doesn't matter. You have to control the food first, and they go into the supplementation. I will say this: the majority of people that, let's suppose Brian is a car, right? And Brian has the best engine, broom, 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 best oil, best freaking windows, best tinted windows, best spark plugs, and I put shit on the gas tank, you're going nowhere. It doesn't matter what supplementation you add to the car. So always diet first.
Yeah, I like that. And then I guess we'll do one more. Like obviously, this comes up a lot. We've talked about it on the podcast before. You can go back to the second and third one. But the pros and cons of intermittent fasting, and does the 5 to 10 calories or the coffee break the fast?
I have a personal opinion, so I want to hear what they have to say about that.
Intermittent fasting. Well, this is way, way, way out of my pay grade, but I'll take a shot from anecdotal experience. I found intermittent fasting works really well for fat loss and weight loss, depending on what the goal is. You have to be careful, in my opinion, of your body type. For example, myself, I have to be careful how long I stay on it, because no matter how many calories I consume during that window, I'll start dropping weight. I can't explain that. Eric can explain it, but I'm not able to keep it no matter how many calories I take in during the window.
From an intermittent fasting standpoint, I would say I do it pretty frequently, mostly because I forget to eat at work. But it's true. But I haven't found anything, the days where I intermittent fast or the days where I, eat breakfast and everything else. I haven't found anything to be too different. I do like it on days where I work out to not eat around that workout time and trying to save all my calories for later in the day. I kind of cheat a little bit because I take a lot of free-form amino acids. But as far as breaking the fast with the coffee, I would say yes, because it's going to elevate blood sugar a little bit. You're going to get that like epinephrine response from it, which is going to drive that up. So theoretically, I think that would break it, but we'll defer to the expert.
If you drink fufu coffee like I do, with extra heavy whipping cream and butter on it, yes, of course I'm breaking the diet. Let me give a definition of intermittent fasting. It's just a certain amount of time that you're not going to eat between meals. And the reason I'm giving that definition is because most people think of intermittent fasting, I'm not going to eat breakfast. Because I went to sleep, I slept 8 hours, then I'm doing breakfast, and then I eat lunch, because that's the easiest way to do it, which actually works. Now, some research shows that intermittent fasting, using the breakfast for not eating it, it tends to make you more sugar intolerance. Okay, be aware of that. Now, And the reason for that is because you slept, you didn't eat, you really didn't move, you didn't do anything, and you have the rising cortisol, which when you drink the coffee, like Dylan stated, increases your epinephrine levels, increases your sugars. It makes you burn triglycerides. So do you break the fasting? If you have black coffee, I don't think so, just mildly, unless you drink a freaking pot of coffee, like Dylan does sometimes, right? I don't. I have a little fufu coffee that is maybe 4 ounces, right? Brian, of course, uses caffeine, extra caffeine. That is not breaking the fast.
In
but
all shapes and sizes, yeah.
Okay, so be aware. Now, there are different types of fasting. The longest documented fasting is 369 days, by the way. So I want you guys to be aware of that. Now, the guy weighed 485 pounds and I have asthma, rheumatoid arthritis, and diabetes, which at the end of the fasting, he had no medications. They followed up for 5 years and he was still healthy. He was drinking water and electrolytes during this time. No food, by the way. The longest documented fasting biblically was Jesus, that went 30 days, and he went what is called a dry fasting diet, meaning he didn't drink water. Most people think that is not possible, you need water. That's a lie. Actually, every time you go into your mitochondria, go through the energy system, you release H2O, by the way. I have 2 patients that were able to do a dry fasting or intermittent fasting diet for a long period of time. And one of them, Dylan knows really well. I don't want to say name, but he's kind of nutso. But what's interesting, by the 11th day, they are delusional, meaning they start hearing, seeing scenes, last 24 hours, and then it goes totally away. All of a sudden, they have the best, insane energy source. They can think, their mind's so clear, no symptoms, nothing. The 2 people that were doing that, they went into having no joint pains or nothing. That's impossible to keep, okay? Now, fasting can be 6 hours, 4 hours, 72 hours, whatever you're going to name it. There's something called motor migratory complex system, and that is when your stomach or intestinal contractions happen every 4 hours. That's why we at 8, noon, and between 4 and 6. It's not because we make all the time. It's because the body has these major contractions induced by the gallbladder, by the way, which is it's a intestinal cleaning system. The bile does that. That's what detergent is based on. So for me, if you're going to use intermittent fasting, it depends how you're doing it. It depends what kind of job you're doing, because night shift, right? Are you going to eat at night? Are you going to eat during the day? I need to know. If I am like most people coming to my office, I don't eat breakfast, I accept that. If you have diabetes or a medical condition, then I start changing it. I want you to have a breakfast because you just fasted, and I want to actually induce insulin sensitivity. Intermittent fasting, minimum hours is 6 hours. If you go less than 6 hours, you're not doing any intermittent fasting. Again, intermittent fasting can be days, hours, understood? So I just want to make sure that everyone has that clear. It works great. In some people, like Ben said, for example, one of the largest studies done, they took the people, and I'm going to use 2 people on each hand so they understand. I had 2 people that ate 100 calories, right? And I had the other 2 people that ate 100 calories. Then they shipped them. The people on the right, or on my 2 finger on the right, they were eating those 10 calories or whatever they were eating over a 12-hour period, and the other people were only within a 4-hour period. When they shifted, even though they're eating the same amount of calories, the people that were eating over the whole day, the 2 calories, the 10 calories, whatever we decide, they lost weight doing intermittent fasting. So what Ben is saying is, hey, it doesn't matter the caloric intake, even doesn't matter that I consume way beyond my BMI caloric intake, I'm still losing weight. That truly happens.
Okay.
Be aware of that.
Nice. And then since we got such a fun crew here for this, approaches to treating TBI and brain health.
Actually, Ben Velasquez is an expert on this, so I'm going to let Ben talk about it first.
Okay, so TBI and concussions. When I lecture on it, I basically make a pyramid of priority. And I think for every TBI, no matter how mild or severe the event is, you're looking at those categories. One is, what's the neurological component?
Whoa. I'm going to put a stop at this.
What's that?
Who is Ben Velasquez and what does he know? Why do you know so much about TBI? Let's go back a little bit into the background.
Preface that. All right. So my background is in engineering, and my interest is just in the mechanical portion of it. In other words, what's the body of the car look like? Eventually, what's the engine and the computer telling the car? But at the end of the day, what's the body of the car look like? So we're looking at one component is the neurological, and I'll work with a neurologist or I'll work with several other doctors like Dylan. The other component is biochemical. So like we discussed, no matter how mild the event, if someone called me and said, you know, I had a concussion or I suffered an event, the first thing I'm going to recommend is that they change their diet because I want a better environment. And then we're going to look at what the symptoms are and decide, is it a neurological component that's the priority, or is it a mechanical component, which is the other end of that pyramid? And we're going to address both. And my component is the mechanical. Where's the mobility at? Where's the range of motion at? How is the athlete or the person managing themselves in space? When they get out of bed and put their foot on the floor, where do they think their body and brain are in space? That's what I'm focused on. And someone like Eric is going to look at all their blood work and is going to change their diet to lower inflammation. And then someone like Dylan is going to treat them to make sure that everything neuromechanically is functioning at a good baseline.
Dylan?
Nailed it. I would say I touch on it a lot from like a visual thing, like assessing eyes. That's a big thing. Going through King Devic, which is like a testing thing essentially you can do for that. Low-hanging fruit, I'll go after a lot of time. Something as simple as light cardio. Because we're trying to, some people run like a Buffalo treadmill test. And from there, we're just trying to see where are they symptomatic at. And then from there, I'm probably going to tell them to work at about 80 to 85% of what their symptomatic level is. And we're just going to slowly build that up. I tend to get people after, you know, they've gone to their athletic trainer or they tried everything else. So usually it's like persistent concussive symptoms at this point. It's not usually acute that they might get a hold of right away. So I'm usually just cleaning up some of the messes that are left behind. But to touch on some of the Ben stuff, like you talked about, like restoring the mechanical things, making sure neck's moving all right, making sure head moving all right, making sure first rib and everything else is cleared out, looking to see if we can get tension elsewhere. Going from there, again, attacking some of the visual stuff. Like we've talked about before, that's a big thing that's missing. You know, it can even lead to further concussions down the road because, again, if your eyes aren't functioning properly, you're not going to see that next hit coming. Another thing, hyperbarics. Eric can talk about this because he's put me on plenty of these for all my concussions, and I'm sure you know about it too. So, yeah, hyperbarics is pretty key. So I'll let him talk about that.
So the assessment that they used was mechanical and anatomical. I'm going to use the chemical component of it. Most people with concussions, even though they do not know it, they have hormonal issues. I would say 79% of them. That does not mean that you go there and say, oh my God, my testosterone levels are low. But yes, it's an idea where I'm going with this. People with concussion, 81% of them with severe concussions will have hypothyroidism. And it's not because the thyroid is not working, because your brain cannot signal the thyroid to make it. I have seen absolutely growth hormone, cortisol levels, even though the studies show, it is normal, but they're always low normal. You need to remember usually a person that has concussions is an athletic person, meaning I play rugby, football, and Brian has experience with this, or have been in a car accident. So those people are not normal by any means. So by the time they get to me, I already have complicated things. My first treatment is always to get the blood test. Where are you on the space chemically? Once I find out where you're chemically, then I'm going to send it to Ben or Dylan, because mechanically they're not where they're supposed to be. You know, can be C1, C2. One thing that Ben pisses me off about is he didn't talk about the fascial component of a TBI. The cranium is surrounded by this fascia, which is super important. People don't understand that. And also that fascia goes into your neck and it goes all over your body. Actually, it's more extensive. If you open the fascia, like if I have a piece of a fascia and I open the center, actually the amount of nervous system within the fascia is bigger than your spinal cord. True or false? It's crazy. And people are not aware of that. When you have a concussion, you can have a rupture within the fascia. By the way, a rupture of fascia is harder to treat than a musculoskeletal tear. So I want you to be aware of that, which you need to actually address that or treat it depending who you're using. Once I get the blood test, I do try to correct what's usually the problem, and it might take 4, 6 weeks, 8 weeks to do that. I always use, and the treatment of choice will always be hyperbarics. Now, I will use red light treatment. I will use laser treatment. I will use cryotherapy, and Brian, you're the expert on that. And people say, oh, cryotherapy doesn't do anything to concussions. I have seen amazing things. I have to argue with a couple of neurologists saying that was voodoo, didn't work. And some of their patients ended up in my office. And I said, okay, let's do cryotherapy. Now, I don't do that anymore because I send it to Brian, of course. But that makes also a difference because the temperature changes, by the way, increases blood supply to the brain, and Brian can get into that. So be aware of that. Now, if you have somebody with severe concussion, or if it's a child, by the way, because I do see children in my office, I always do hyperbaric chambers. Doesn't matter what the chemical picture of that is going to show me, because I have to fix that. And the reason hyperbaric chambers work is the brain has a lot of capillaries. Those capillaries are very, very small. The hemoglobin, which carries your oxygen, is a school bus, and that school bus is very large. So when it goes from a little vein to from an artery to a capillary, that school bus doesn't fit on that capillary. So the way the hyperbarics work is, instead of having a bunch of school buses full, I push a bunch of little motorcycles with oxygen in there, basically free oxygen in the blood, until it can get to the capillaries easier, which allows the brain to actually start working, because it's going to repair.
Yeah, that's interesting, just because some of the research in the breath world, where we start to develop, like, a lot of the protocols are air hunger based, so you get to certain CO2 levels.
Absolutely.
And like that's supposed to, and like, so obviously their argument is that more oxygen gets to the front of the brain, and they've measured that has been successful, but it also can be impeded by the concept you're talking about, where it won't even get there.
Absolutely.
Yeah.
Mechanical. It can be a mechanical issue.
Yeah.
The blood supplies don't get in there because the fascia is tight on the neck, whatever blood supply. That's what you have to address the anatomical and the mechanical component of the TBI. As physicians, we do not do it because we don't know the person that you need to send it. By the way, the best physician is the one that knows when you do not know something and you have to pass it on to the person that can help that patient.
It takes a village.
Yes, absolutely. I have been lucky enough that I'm surrounded by Ben, Dylan, you, so I can have, hey, you need to go see this, you need to go see this person, and that's why you actually get the best results. It's an overall treatment which makes a huge difference.
Yeah, it's just funny to see, because like obviously the concussion testing in the NFL is usually pretty standardized. Obviously, it's getting some laughs in
No
that realm.
comment.
Well, it's like, so it's obviously the impact test. They do the balance. They do light vision. Nothing crazy like what we've done, Dill, in that realm. So I'm trying to figure out all the components they brought to the table. Like, yeah, they're checking to see if your neck's sore, but they're not putting hands on you. And then you're not doing eye tracking or any training outside of like basic balance peripherals.
I'm very familiar with eye tracking. I have to work with a lot of hockey players. There's a guy named Curtis Brackenberry, which had a lot of concussion because he was a goon, right? And this guy taught me a lot because all the issues he had. And one of the tests they have a panel of lights in front of you. And it's kind of funny because they can dictate how bad that concussion is by just following those lights in this panel.
That's the Dynavision.
Okay.
Yeah.
Is that the quadrants, or is that just like the delay?
No, so they break it up. It's just like a big circle with smaller circles of lights within it. And then they can essentially put it to where they can test one side or the other more. They can actually change the color filter and put colored glasses on you to see if you're suppressing an eye or not.
They can predict.
Yeah.
It's just crazy how cool that works. One person that will be cool to talk to is Curtis, because not only has the experience, he lived that life, and he also have seen multiple experts all over the world. And it is crazy the information he has sent me. And I want to talk about this because I was just getting my license to carry a gun, right? And here's a guy, Special Forces, and I don't know if you remember Brian. He goes and starts talking about, what was the name of that brain thing?
Which one?
When you're looking at something and
Like your dominant eye, like that concept.
I forgot what it was. There's some kind of reaction that when you're moving the target and shooting, there's a name for it. And he showed me.
They're going through OODA loops.
Yes. What is it called?
OODA loop.
OODA loops. And I had
So like agility work, observe, orient, decide, and then act.
Yes, and that is actually a sign of, hey, you have concussions. But it's crazy because I'm learning this from a Special Forces guy that all he does shoot people, Like, wow, he knows more about the brain than I do. So I start looking at that, and then Dylan sent me a bunch of research. I have no idea. So now I make people do movements and reactions in the room just to see what happens. I have a guy actually that by just moving his hands, he will get dizzy. But if he will do the movement with no hand movement, he doesn't get dizzy. So, I mean, I would have missed that if I just sit there and don't move and just move your eyes, right?
Yeah, just
just
balance.
Yes,
like one
it's
foot,
crazy.
whatever,
So
yeah.
be aware of all those things. And again, surround yourself by the right people, and you'll do well.
I got you. You have anything to add to that? Because the fascia stuff intrigues me.
Yeah, the fascia stuff is interesting, and I agree with Eric that no matter what type of event it is or how severe it is, you have to ensure that the fascia is organized. That's the best way to think about it, because it's organized in very specific patterns and places, and it's very easy to get disorganized. That's where the mechanical portion comes into play. So the easiest way to understand it is that you could do all the visual exercises in the world, you can change your diet, but if you don't fix the mechanical dysfunction, you're not going to fix the system. Same way if you have a bad diet, like Dr. Serrano said, you can take all the supplements you want, but you're not going to have a good biochemical foundation. I would add that depending on what type of athlete or if you're a military guy, once you're able to get the symptoms to go away in the recovery phase, your focus, if you're a military guy, in my opinion, should be more visual. It should be more neurological. If you're an athlete, it should be more mechanical because you have to accept force and you have to learn how to dissipate force. So it's a basic principle of mechanics. So you're accepting force from the ground and you're dissipating it somehow. So no matter how hard the hit, everything has to be operating the right way in synchronicity, or else you won't be able to accept force, communicate it if you're an athlete, and dissipate it if you're taking impact.
Yeah, I would say especially the way that you get your concussion, like from an athlete standpoint, like getting an absorbing force, where if you're military, a lot of times it's sound. Sound is going to trigger that.
I forgot about that too, especially sound. When they're freaking blowing your head or it's shooting. That is very true.
And so what's, as far as the damage from sound versus like the physical shaking of the brain?
It can be the same. Actually, sound can do enough damage. Deafness, tinnitus, all those sounds have concussion, actually, believe it or not. But it depends on what you're using, of course. High caliber versus low caliber versus the cannon versus the machine gun. So you can actually absolutely have that. So don't confuse, oh, I had a hit by a baseball, oh, but a bum blew next to me, can do the same damage.
Okay.
Yeah, more from like a physical standpoint. I would say I use that on my intakes whenever I have military personnel in the clinic. It's the first thing I ask them, like, what artillery were we handling? Like, what were you doing for your job? Because then that gives me a lot of insight. If they're just coming in for neck stiffness, there's probably something else that's being missed along the way.
I like that. Moving on, this is particularly targeted at Dill from the lovely Coach Cav. How would you sum up a 90-minute presentation on co-contraction?
Oh, shit. Oh, way back. There we go.
We're good.
It's really just using opposing joint forces to balance out a joint. I mean, I guess that's the simplest way to put it. We were playing around with it earlier today. Just using, a quad and a hamstring to kind of hold a knee together in space, or using a soleus and a hamstring to hold something together, whether it be like co-activation, same thing if they're working same side together. It's just using something to restore integrity around a joint by getting a feedback loop initially until it turns to a feed forward loop where it just becomes normal.
Yeah, subconscious even.
Yeah.
When are good times to use those?
Post injury is usually the easiest time that you're going to do it, especially because you want to restore just the kinematics of the joint. But I mean, I've used it as just a warm up, like in general, for a lot of times. If I want to go through a warm up and make sure everything's functioning efficiently, like we might just hit that little split squat drill that we were doing right before hitting a leg session, and it's like everything's woken up and doing what it needs to do right before I go into anything, rather than spend half an hour going through a long drawn out warm up where we're just trying to isolate so much stuff and nothing just gets reintegrated.
Just for my own curiosity here then, so versus the prayer hamstrings that we do in that realm where it's just an isometric for everything.
No movement,
Yeah,
but you're causing a contraction.
Contraction, but is that technically co-contraction?
Absolutely, that's a co-contraction because actually you have the forces of the hamstring what do your quads have to do?
That obviously extend.
Stabilize
Yeah.
those
Absolutely.
joint.
Okay. All right.
So that's looking at like maximal shortening.
Small brain.
Yes.
Yeah.
Yeah, it's looking at like maximal shortening. So that'd be like FRC is big on that stuff.
Yeah, that's what I was.
So
trying
yeah,
to-
that's pretty much what it is. Like you're working the maximal amount of shortening so that we can handle a joint. Because I'll put somebody in that for like an adductor, like what we were talking before with the oblique. We might reach our hand forward, right, to bias a rotation to get into my adductor a lot tighter because I'm putting it on maximally shortened range. He's fine if his leg's away from him, but the moment he has to bring that leg in tight, no chance.
No bueno.
Yeah.
But that makes sense. But I was separating or categorizing the isometric away from the co-contraction.
Well, it's pretty much is the isometric. The only thing that's changing is the fact that you're shaking all over the place, which is throwing you out of position. But you're really just trying to hold an ISO.
Okay.
We tend to isolate body parts, meaning that's why we have cardiovascular versus neurologists. And the problem is that the body works together. And when we start doing, we're going to have this isolation and this other isolation. For example, today we had a client here that, he's talking about isolation of the muscles, which the way he was doing it actually, and I might be wrong, but I would say it was incorrect. True or false, Dylan?
Yeah,
I mean, he was taught just recently that by doing certain amount of this type of movement, I can isolate my shoulder better, which you can isolate your shoulders, but that doesn't mean that it's working with your back. It's not working with your lat. Then, I can isolate all the shoulders, and it doesn't matter. It's not working with your back. I don't care how big your shoulders are. You're going to get hurt, which that's what actually truly happened.
But that's why you need a tactical plan that has everything included. And
absolutely.
You can't just stabilize the shoulder and think it's going to work. All right, cool. This is kind of out there question. Treatment to help carpal tunnel exercise.
Whoa, I love this.
Yeah.
The stupid chiropractors will treat this, but no. I would say I see a carpal tunnel syndrome in my office. I see 3 a week. 60 to 80% of them will respond to diet immediately. I'm talking about almost immediately. Of that 60 to 80% that don't respond, it's because they have a nutritional deficiency, i.e. B12, thiamine, something that is actually causing it. Most people think it's mechanical,
Yeah.
I worked, I pitch, or I sit on my...
It's arthritic, it's
yes,
whatever, yeah.
No. The top 3 allergies are dairy, wheat oats, and peanuts or peanut butter. I mean, if I eliminate that, usually 50% of the people, I already feel better. But those people also have a nutrition deficiency that I have to do. I see in my office at least 2 a week also that already have bilateral. If you have bilateral carpal tunnel syndrome, you don't have it. It's wrong. It's coming from your spine. It's coming, and I'm laughing. I was giving crap to Dylan. You have to go to a chiropractor. Never seen bilateral carpal tunnel syndrome that is carpal tunnel syndrome. Ever, never. 32 years of practice, never seen it. They come with bilateral surgery, right? And they go, I felt great the first 2 weeks, and then all my symptoms came back. The body will never allow bilateral. It doesn't. It has to protect itself. So it will affect one area to protect the other so you can do it well with it. It's survival, okay? The body does not want to do that. For example, your nose gets plugged. How often have you have a bilateral nose plug? Never.
Yeah.
You got boogers on one side, but the other side is open because you have to
protect
it's a protection.
Yourself. Or people default to the mouth and they become problems.
Yes,
yeah.
Absolutely.
But yeah, it's the same. The nose constricts and dilates back and forth all day.
Yes, so be aware of that. The body knows better. Carpal tunnel syndrome, you must always change your diet. Now, the reason is not that it's an allergy to that food that is causing issue. I see also carpal tunnel syndrome get worsening with drinking, specifically alcohol. Is it because the person is allergic to wheat, of course, or potatoes? Because, those are, corn is the other one I can think of, right? I'm rice here and there, but wheat is the main one, right? So I would say I eliminate alcohol because it makes you retain water. Almost everybody says, I feel better. But, of course, it's very hard to keep away from that. But just be aware of that. I let them handle the rest.
I don't deal with much carpal tunnel syndrome, but I would agree with Eric that if I saw bilateral, I would have to send them to you because I'd want to get their blood work done and see if there weren't food allergies done. But if I see a case that's just unilateral, generally I'm looking to see from a mechanical standpoint if the usually it's not big movements. It's people that are involved in micro movements. And I think the data shows that it went up like around 400 to 600% after the advent of the mouse on the computer.
Well,
I'm not sure if that's accurate, but unilateral carpal tunnel syndrome did.
actually, I would like to ask the listeners, there's 2% of the entire population with carpal tunnel syndrome that will respond correctly to the surgery. Only 2%. Very low. And those people have issues, truly trauma to the area, something severe. I broke my bones. When they healed, they didn't heal correctly. I had a tumor, for example, in my hand. So there's 2% out there that truly have a surgical case. Now, I would like to ask the listeners that have carpal tunnel syndrome surgery, how many of you guys, I'm going to love this answer, got better immediately after surgery, and how many of you guys had it back? I can wait for the listeners to come and tell Brian.
I'm guessing a high percentage.
Oh, I can wait for that answer.
Because
yes.
you're not solving the problem.
Yes.
So Dil, so you treat people with carpal tunnel?
Oh yeah, we get it at least 5 times a week with all these people that come in. I would say big things that I notice, like you said, bilateral. It's not carpal tunnel. Usually you're looking at something from the neck, maybe like a central disc bulge. So every time someone comes in with carpal tunnel, we'll always do stuff for the neck. Like, doesn't mean I won't treat down by the wrist, but I'm always going to try and clear out some of the neck first. So we'll just layer it into whatever we do. From there, you can kind of go through and check for peripheral entrapments, whether it be through the forearm, up through the pec, shoulder, wherever it might be. And other times I might just load the wrist in general because, like I said, with the advent of the mouse, we're stuck into this lengthened out position right here. So sometimes I'll actually just load this in a position so that we actually get it to work because they're usually not training they are training their forearms by just clicking the mouse. Yeah. But they're stuck into this lengthened position and they can't realize why it's so tight into that position if it never moves out of it.
Yeah, so he's signaling to the front of his forearm where you actually trying to get contraction.
Yeah, so now I'm going to make them contract and go through some things to kind of open that back up. Because like Ben had me doing Aldo the other day, just put my wrist out here. Like, I can feel the tension that's in there. So most likely, I need to go through and do some of this stuff to open it up. Like you said, those cysts, I've seen it with cysts. That's probably the only time where I've seen true carpal tunnel.
Yeah,
I got a little fracture here, and I've got a cyst underneath that. So if I spend too much time gripping anything heavy, it just starts to burn. But other than that,
are those like the Bible cysts, like where they used to?
No, Bible cysts. The guy who says you can. The reason they call Bible cysts is because you used to. And I did this.
They used to break them with the Bible. Yeah.
Yes, I did it with a book. I don't like cysts on the knee. Oh, you have one of those? Turn around, and
I've only
Wax
seen
the shit out of them.
Yes,
I've only seen the Bible cysts in like the top of the wrist.
Yeah,
that's
just
where they
ganglion
usually.
cysts.
you can have on the top. You can also have them behind your
like a Baker
knee.
cyst. Yeah.
Okay.
A Baker cyst actually is that. So I was, if I'm pissed at you, I'm gonna go. I use it's called the Griffith book, which is really thick, and I whammo. And by the way, it hurts so bad that people cry. And then they call me the next day and say, "Oh my God, my pain is gone."
Yeah.
And I have done that on patients that I really, really know.
Because a lot of time people will just go in and get them drained now.
Yeah.
And then they tell them, it's like, well, it's probably going to come back. And they say, okay, anyway. But usually they don't drain them until it becomes big enough of an issue. But a lot of times you can just pop them yourself.
All right. Boom. Then this is back to still kind of on the diet concept. We kind of touched it already, but what effect do sugars have on us when we have the flu and we have viruses?
Okay, I'm going to answer this question because actually they did a study on white blood cell speed mobility. Meaning I'm going to measure how fast the white blood cell goes from the arm to the arm. I'm making this up so you can see it. So let's suppose that I move at 10 feet per second. I eat sugar and I go to 50 feet per second. I go way lower. Let me say this. You move at 50 feet per second without sugar. I eat sugar and now I'm made at 10 feet per second.
Okay, boom.
So it's a huge reduction on mobility of those white blood cells to get to the place. 1, 2 is when you eat sugar, you increase insulin levels, which allows you to get more inflammation. So you have to be very careful when you're eating carbohydrates. I don't want to say sugars because it's carbohydrates. So absolutely, when your sugars are higher, you have decreased motility of your immune system. That's why people with diabetes will have more infections, number 1. Number 2 is it reduces the ability of the vessels to contract or relax, which is another issue. So be aware of those things. You do not want to do that because you want to, and that's Milo, that's Ben's That's been seen
It's
out
just
there.
a little life on the podcast. It's a little life.
So be aware that when you are sick and having fevers with a virus, do not eat sugar. Stay away from it. That's why bone broth, or used to be grandma, oh honey, you need soup.
Yeah.
That was the great idea because soup is fat. Usually it's truly made by bone, right?
Yeah.
So it will be bone broth and then add other things to that. I will use a high protein, low starch diet to any kind of.
Any flu or virus.
Yes.
Yeah.
Like I made carne asada the other day when I was feeling like shit. Yeah.
Yes.
So especially on top of what he's talking about with carbohydrates, like what's the one thing that you crave when you're stressed?
Yeah. Sugar.
Carbohydrates,
Yeah.
right? We're trying to blunt that cortisol response. So the big thing is like making sure that I'm staying on top of my supplementation and everything else, and not just giving into a craving, like giving my body what it actually needs, not necessarily what I
giving
want.
weakness.
Yeah. I'm just looking for an easy way out of the suffering.
Yeah, that makes sense. Or any short term,
Yeah.
any short term, short term return. I think this is a serious question from Cav, but best sups for hair loss. And then there's also a question on here about any way to reverse gray hair. Is that just genetics?
Well, that is actually, there's two cases in which it's not genetic. A copper deficiency can induce gray hair.
Okay.
So if you do have if your family never had gray hair and you start having gray hair, you might have low copper or too much zinc balance. Be aware of that. Now, for supplementation for hair loss, and Cav is a baldy guy, so I want to say that.
Yeah.
Actually, I use in my office, my partner, Dan, I don't do it because I think you have no hair, who gives a crap, you know? I look sexy with no hair. I don't have that problem, but I have a problem with gray hair. I would say I use PRP, GHCQU, and there's other things you can use, but it does work. Now, the problem with those things that are working, or exosomes, I don't know if people are familiar with exosomes, you can use those. The problem with that is that you have to use it. It's not going to be permanent ever.
So you have to use it forever.
You might be using it twice a year or 3 times a year, depending how your hair grows, but you have to redo it. It's not going to be permanent.
But even so you're saying PRP?
PRP in combination with GHCQ, which is it is a peptide. Forget that. A peptide that adds to the hair, yes.
Okay.
And it works, but you have to do it frequently. We add exosomes in my office because we have a rapid hair growth response to that.
Cool. And then on kind of backtracking, I should have lumped these together, but the protocols after elbow surgery or really any orthopedic surgery to speed up healing. Obviously, we talked about diets that would approach that, and then potentially the co-contractions as well. Of
course, depends on the injury and the surgery or whatever they have done, but I will absolutely add supplements there. Collagen helps the healing. Glucosamine sulfate helps the healing. Again, depends on what the injury was. Vitamin C, actually high dose, will also help. High protein diet. Studies show that whey have shown to help. Arginine also shows to help. Humana Fort, when I did it, help healing. So it depends on the injury that you have or the surgery that you have.
Yeah. On top of that, if it's bone related, BFR is huge. I mean, just Mario Nova can talk on this, for days, but just putting up like your, not tourniquet, but the actual cuff itself, just pumping it up and just having them lay there at 100% LOP or whatever, whatever your protocol is, and just lay there for a couple of minutes and then just take it off. Like, that's enough to stimulate osteogenesis, and laying down new bone over top of that, especially stress fractures, that's huge. But like a lateral epicondylitis or anything else where the bone is starting to get pissed off, it's pretty beneficial. Going through co-contractions just to restore, range of motion, I'm huge on using that. Because it just presents like a sense of safety around the joint. If the joint feels like everything's working around it, then it's more apt to be free, and now I can load it into more isolation stuff or whatever I want to do. But yeah, I would say those are a big thing. Another thing is making sure I'm gripping. Like what's one of the big things that gets missed from both from a neurological standpoint and just from a functional standpoint is I always want to make sure I'm gripping something when I'm in a sling. Right, because now I'm starting to lose rotator cuff strength and everything else, and my grip is linked to my rotator cuff. So I just always want to make sure my athletes or whoever I'm working with is at least working on some sort of hand strengthening. Could just be a rice bucket, kick it old school, just bury my hand in a rice bucket, wiggle the fingers, do whatever I got to do. I'm big on that too. If I have someone who's not responding certain ways to the co-contraction or load, I'll send them home and I say just bury your hand into a rice bucket, wiggle your fingers around, spin your hand around, do all this stuff, because we're managing to stress all the muscles and tendons around the elbow without actually actually loading it up and making you squeeze anything to piss it off.
Yeah.
I'm going to give you an easy rule here, Brian. It's called the 20% rule. Go ahead, Ben. You're smiling and laughing there. So I know you have
Ben's got
something
some
to
good
say.
stuff.
But hold on.
I don't have a lot to say here.
It's called the 20% rule. So I go 20% above and 20% below where the pain is. So, for example, you have pain at 290 degrees. I want to go 110, and I want to go at 70 degrees and use exercise that strengthen that range of motion, that small range of motion, and eventually that range of motion is going to add to that full range of motion, and the person will get better.
What type of surgery was it?
Just any speed up of orthopedic surgery healing.
Ah, okay. So orthopedic surgery healing, I like to play Sherlock Holmes. So first thing, was it a contact injury or was it not a contact injury? If it was a contact injury, then you can trace it to that pretty easily. But if you have shoulder surgery because you're a non-contact athlete, like a pitcher, then you have to look at cause and effect. So they already had the shoulder surgery or elbow surgery. I want to know why. Why were they put in that dysfunctional position before? What's going on in the pelvis? What's going on in the scapula? What's going on in their neck? What's going on in their foot and ankle relative to their shoulder? So that's the first thing that I would do. There's a ton of exercises and protocols, and people get results with a lot of different things. But I think as a general rule, if you respect the same rule that we respected for concussions, so if it's an elbow or shoulder injury, there's a mechanical component, there's a biochemical component, there's a neurological component. You have to address all three. So if you got out of surgery on Thursday, your diet should have been good before surgery to elicit a good environment. If the other thing about rehab is it should be the shortest amount of time possible. The problem in North America is it's like go to PT 2 or 3 times a week, especially for an athlete or a special forces person or special ops person that they have to get back in the field. The shortest period of time.
It doesn't matter. I have my protocol. It doesn't matter what happened.
Yeah.
I have my protocol. I got to follow it.
3
So,
hours.
Yes.
It's like I'd rather see you doing rehab 4 or 5 times a day for 30 minutes than doing it 2 hours 3 times a week. Because now you're stimulating the neurological component. The frequency is about getting back to normal. I think the other thing, if it's a unilateral injury like a shoulder and elbow, I found there's great value in training the opposite side. I don't know what the numbers are, but there's some crossover. If you train the right arm, the left arm gets
I
a
think it's
benefit.
like 15%,
Yeah,
if I
right.
remember.
21,
So it's like 15 or 20%. So now you're starting to get percentages from your diet, from all the other stuff. Now your rehab, instead of taking 9 months, took 3 months because you did everything right.
Yeah, I think that's just like keeping those 3 components in the front of your mind is massive, because a lot of times people think, oh, my shoulders hurt, I'll go get it mechanically fixed.
Yes.
Or strengthened and that
chemically fixed with a shot, which rarely works.
Yeah, which I don't think I've had a good cortisol shot in my lifetime, but
That's the one going through your foot.
that was, I think we've told this story on here before where
Yes.
I was getting a PRP shot into my big toe, and the lady pushed the needle all the way through my toe and sprayed me in my shirt with the cortisol.
I'm Brian Coleman.
And she says, "Oh, that happens sometimes." Which is ridiculous. But also to Dylan's point earlier, and to your point with the diet around these things, like it's not an opportunity to like be weak.
Absolutely.
It's not a self-pity party where, okay, I'll eat for 2, or not the pregnancy concept.
With that which I do that though.
Yeah, but there's plenty of guys that like,
Yes.
okay, my season's over after the surgery, so all right, I'll eat like crap. I'll rehab once I get healthy, I'll get in shape, and like that's probably the worst time to do so, because you're looking at like the fundamental.
That's the difference between good and excellent.
Yeah, for guaranteed, or just like
Yes.
task completion and
Yes.
and good.
Yes,
in that
absolutely.
realm where it's like I feel like that'd be the fun. Like so, I guess in my own interest then. So as far as like the actual rebuilding of, obviously this could apply to any surgery in that realm. But say I eat a shitty diet versus I eat a good diet, like how fundamental would that compromise the fundamental of that healing of that tendon or anything? Or
It is. Think about this. Again, think like a car. You change the oil, but you don't put the fuel, you're not doing absolutely nothing. You have to put the right fuel to get the car going. And people do not understand that. Even they have done studies on orthopedics, actually surgeries and rate of infection. When the sugars are high, only for 7 days prior or 2 weeks prior to the surgery, there's a test called fructosamine. By guys, make a note out of this test called fructosamine. I can predict your infection if your fructosamine number is about a certain number. I don't know what some labs uses. I'm gonna give you a number, 400. If your fructosamine levels are over 400, there's a high prediction that you're gonna get a joint infection. So that tells you how much sugars are important. Fructosamine measures about 2 weeks of your sugar levels. And if you do that test before orthopedic test, you can like actually predict if that person is gonna get an infection.
Interesting. That's well, just just because they get cut open and they're
Yes.
and they're that weak. Interesting. This is the last question, probably more targeted at Doc because it is an outlier scenario. So baseline liver enzyme numbers. I also don't know how big their brains are, so maybe they can help. But sorry, baseline enzyme numbers and what can they have an impact on, or what can have an impact on them? This person has high liver enzymes and has been unable to solve the problem.
Let's define what normal levels are, defined by medical sick people, right? Checking numbers. So this, and I'm assuming he's talking about AST and ALT.
AST in particular, yeah.
Yes, okay. So by the way, AST, short about short, and ALT long term. So that gives you an idea. So the short term adds more to the short, like if you worked out and that's going to affect you more quickly. The one is also long term. The one left, there's two left, it's alkaline phosphatase and GGT. So I'd never check those two only. I gotta check all of them. Now, I can go on what affects this. For example, first of all, normal levels in the literature on a lab is 0 to 40, both of them. Which you can, if you have 0, it's impossible, okay? Something is wrong, but the lab said that that's normal. The old values were 0 to 70. Old values before that were 0 to 120. So they have changed that a little bit. Then 1 year was 40 to 120. I don't remember the numbers. Now it's 0 to 40. If your levels are about, the only time I will worry about those values are they're above 200, okay? And I have no reason to find out whether they're 200. Now, what can elevate your enzymes? If you go running the day before you go do your liver enzymes, you're going to have high liver enzymes.
Okay.
If you get hit by a ball, if you get hit playing football, your liver enzymes are going to get elevated. So be aware that it's a reactivity enzymatic response because they're necessary. AST and ALT are necessary for your Krebs cycle. Anything that requires energy is going to affect the AST and ALT. Now, if your levels are less, this is me personally, based on things that I have seen, if your levels are less than 17, which they say is magnificent, or is great, is normal, no. If your levels are less than 17, you have a B6 deficiency. Be aware of that. So don't believe everybody that says, oh, low is better. Now, that's what I'm going to look at other values. That's what I look at GGT and alkaline phosphatase. Now, if your GGT is above 20, no, let me give you a real number. If your GGT is above 60, there's no life insurance going to give you life insurance. That tells you how important that number is more than ST-ALT. The reason GGT, gamma glutamine transferase, makes glutathione, okay? The people know that when that level is high, you're full of toxins. Something is happening on your body. You're cooking in there something that is going to affect you later. So they do not give you life insurance. Doesn't matter if you have AIDS. Doesn't matter if you have diabetes. Your GT are high. You're not getting life insurance because it's highly. If you look at the internet right now, it's a predict death rate with GGT is the best predictor of death. So be aware of that. So in that case, what I would do is, and by the way, the most common reason for elevated liver enzymes, of course, is alcohol.
Yeah.
Okay. Don't come here and tell me, oh, my liver enzymes are elevated, but I have 5 beers. It's going to go up. 2 beers will elevate it. 1 beer will elevate it. Depends on the size of the person and other conditions, but that gives you an idea. So you have drinks. By the way, it takes 72 hours for that drink to get to that effect to go away. So if you drank. Number 2, Tylenol. If you take a Tylenol, actually, if you take a Motrin, it's going to elevate it, but Tylenol does more damage to the liver. If you take Tramadol, which I know is very common on athletes right now, that's going to elevate your liver enzymes. If you say, oh, I got to go get blood tests, and I ran from the parking lot to the lab, it's going to get AST elevated. ALT will not be elevated, but that gives you an idea what can elevate that. So if you want a true value of your AST, ALT, first of all, I'll do I repeat the blood test, but I IgGT, alkaline phosphatase. I don't exercise for 2 days. I don't drink alcohol for 2 days, and then I go get it done.
Okay, give you a cleaner look at it.
Yes.
And then just to close that one out, how do you adjust if they are
Okay,
elevated?
then if I suspect there's some kind of issue, then I'm going to go to an ultrasound. Let me check what's going on. The number one now reason for liver enzyme elevation is non-alcohol fatty liver disease. Let me repeat that. Non-alcohol fatty liver disease. I mean, there's no alcohol involved. It's just that you're eating junk, sugar. Your liver accumulates fat because it has to protect itself. Because if you put a sugar inside the cell, it might blow up because uncoated pressures. So the cell has to protect itself. I have to change the sugars to fat because the fat don't make me explode like sugars. So that's why you get fatty liver. And then you have to go into a protocol to change that. But that is the number one reason for actually elevation of fatty liver or enzymes.
Got you, boys.
So because you have a lot of military listeners, this is a question for Eric that's a segue from the liver discussion. They do a lot of controlled burns in the military out in the field.
They have a name for those
they're exposed to that. A good percentage of them are exposed to that. What's the process when they're exposed to that, and what does the liver play a function?
Actually, that's a great question. I forgot the name of of those pits.
Right.
I think they call it pits. So in the military, so when they're on a base, they need a place to dump all the trash, right? Now, I don't want to leave that trash right there. So what I'm going to do, I'm going to burn it all. And when they say they're going to burn it all, everything goes in there. If they find whatever is going to go in there. It's a container, we don't know what it is, we're going to throw it there. It's funny that you mentioned that because I've seen a lot of cases, because I see so many people, I see a lot of issues with those. Those people require a detoxification, actually. I use a test that is called Great Plains Laboratory, and that is a toxic screen urine test. It's fantastic. I'm going to give you one case. I had a lady that has seen multiple doctors, a bunch of doctors from Colorado, came to see me. I had no idea. Her liver enzymes were off. Everything was off. He had liver biopsy. They still couldn't find it. I said, listen, lady, let me do a freaking one of those tests. And I forgot what she came out with. That was, the lab even called me. And what happens is, where she lived close to the base, the military base. And when the planes take off, or they're leaving, and by the way, freaking Ben is a liar. He used to be a pilot, commercial pilot too. By the way, when you're flying, you dump fuel on the floor. You dump it. You cannot see it. Sometimes you can, but you dump droplets of fuel. This lady was all freaking fuel-based toxicity on the liver.
Wow.
And once we got that test back, I said, I didn't know what to do. So I called toxicology. I said, what do I do with this value? And they said, that's a false value. That's a lab that is not officially blah, 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 blah. And I said, well, why don't you repeat the value? Which eventually they did. And they go, oh, yeah, it's true, Well, no, what do we do with this patient? Well, you have to use methylene. I know this is crazy. Methylene blue, which is a medication or a supplement now. NAC, which you don't want to buy from Amazon anymore because they don't sell it there anymore. You have to use glutathione. You have to use chelation. You actually have to detoxify that patient, which that's what we did, which, by the way, she had joint pain, lost vision, paralysis, and all that went away once we removed that. She's amazing. I have one more case that I have in which I had a lady that have this symptoms for 2 years, so 22 doctors, did all kind of testing. I did a tox screen, and she came back with high thallium, by the way, and I'm going to explain what thallium is. Thallium is a non-odor, you cannot see it, you cannot smell it, gas. Only 2 people have thallium, the hospital or chemical companies. This lady had been everywhere, right? And I get a high thallium. I said, no way. By the way, this lady had been getting divorced for 2 years. Okay, this is a cool case. So I called the lab and I said, are you sure this lady have high thallium? Yes, and the lab said, you need to send this thallium test to forensic labs. Well, we sent it to forensic labs. 2 days later, the police was in my office getting her records, because what happens is she had been getting divorced. I went into talking to her after that. She'd been getting divorced for 3 years, but her husband was very nice. But, I love you. I'm going to make you shakes. He owned a chemical company, access to thallium, and he has been killing her slowly.
Oh my goodness.
And by accident, we discovered thallium. The chart disappeared. I don't know what happened to the patient. It was a pretty cool case. They took everything. So it was pretty cool. Actually, she's doing well. It's funny. And then she ended up owning the company, by the way.
Yeah. So, but for the military guys in that scenario, like massive detox.
You have to actually detox. Now, you have to do it slowly because you got to be very careful. Toxins accumulate on your fat cells. That's why some people, when they lose fat, they say, Eric, I get so sick. I don't want to lose the weight. And the reason is fat. Remember, you have water soluble or fat soluble. That's the only two ways to get rid of your toxins. Either I pee it out, sweat it out, or I shit it out, right?
Yeah.
You cannot do it, then fat cells accumulate it. Now, people forget that the freaking bone is fat. It is not freaking calcium. The inside of your bone is all fat. I want you guys to bone marrow. That's when you cook the bones, it's all fat.
Yeah.
Well, accumulates in there. So you clean the blood, but now your bone marrow wants, it's clean. I'm going to dump it all out. And then your levels come back super high. So it takes months and months depending on whatever toxin you're doing. If you have a person that is having so many issues about losing weight, I detoxify that person. I didn't believe in detoxification at all until I had people that were really working on losing weight. I get really sick, I puke. And actually the husbands or the wife will send me videos. He lost pounds and look what's happening. I say, okay, I'm doing something wrong. I'm going to look deeper into this. I detox those people first, then I make them lose weight, which makes a big difference.
That's why a lot of athletes pop positive on drug tests. Like if they go down a weight class, it's really, it becomes really obvious with some of that stuff where it's just already stored in their cells, especially like THC.
Yes.
That will pop up. So say they've been clean for a while, they cut down a weight class, it'll pop back up on a drug test.
That's a little nuance for you.
Well,
It's just so like I initially like how you phrased it. I was like, oh, is this almost like an addiction where your body's addicted to this state and then it takes time, but basically there's layers to the detox.
Yes,
you
absolutely.
Have to, like, get it. So it's water fat than like bone fat.
yes.
In essence.
So be aware of that because most people are not aware of that.
Cool. Thank you, boys.
Thank you. That was awesome. Hey, wait a second.
Pleasure.
Hey, Brian is aware of this. I'm building a new place. It's going to be a massive barn. And I have many friends, Ben, Dylan, you, and I have other people that are pretty well known that are seeing what I'm building at my house. And actually, we're going to make a gym that's going to be open. And, you can only come if you're with Brian. If you don't know where Brian, you cannot come. But actually, it's going to be open. We're going to have people there. And I want to offer, if you guys are interested in having either a conference or a one day or a seminar, whatever you guys want, and you say, hey, I would like to see this person there. I know almost everybody in the industry, and Brian knows a lot of people too. If you guys want to have a one-day seminar or say, hey, we would like to go there, call Brian.
Workshop,
etc. Call Brian, call Dylan, and we're going to come on. Once it's built, it should be finished by December. We're going to start doing that. One of my biggest hobbies, of course, dog training. Bart Ballone is a famous dog trainer. He's going to be coming anyway, but let me know because I like to do it because it will be fun. I will offer you food. We'll offer you the food actually if you want to do it because my wife is nuts and wants to do that. But I say hell with you guys. But be aware. Talk to Brian. Talk to Dylan. And talk to Ben. And we like to put it up.
Boom. Easy. Yeah. If you had any interest in a seminar workshop with obviously the doc and anybody that's been on the podcast, any of the boys, let me know.
Thank you guys.
Thank you.